Good afternoon. My name is Stephen Ferrante. As a long-term mental health advocate, I'm really honored to have the opportunity to moderate a panel this afternoon on resilience. Up to now, during this mental health summit, you have heard about wellness, you have heard about self-care, and you have heard about empowerment. All important ingredients when it comes to resilience. But this afternoon, you're going to hear from three very powerful people. They're going to share their stories of resilience with you. They're also going to share their perspective on resilience, and the information that they're going to provide to you is going to be really critical in your own effort to become stronger and to support other people in your life. So when we think about resilience, a couple of things that I want to actually help you bring to mind is when we're talking about resilience, we're talking about our ability to manage, to work through, to adapt, to recover, and perhaps most importantly, to endure. And not just to endure for the present, but to endure for the future as well. So as I mentioned, I want to get to my outstanding colleagues here. I've had the opportunity to meet all three of them, and I'm looking forward for you being able to do the same. We're going to start with my colleague, Susan. She's going to share with you her personal story of resilience and also her own personal definition. From there, we'll go to Barbara, and then we'll move on to Cole. We also look forward to the opportunity to dialogue and have a conversation together this afternoon about resilience, as well as to field any of your questions. So Susan, if you'll start us off, please.
Absolutely. Thank you so much, Stephen. And thank you, everybody, for tuning in today. Really appreciate being able to be here with you today. So my name is Susan Nyamura, and I identify as a woman in long-term recovery. And basically what that means for me is I have not had a hospitalization or an incarceration since December of 2006. And I know that's a lot because for me, I happen to be a person that identifies as having a substance use disorder and a mental health disorder. And the way this all began in my story of, I guess, despair and distress started at a very, very young age. And it started basically surrounding trauma and person and environment and a lot of different things that kind of started my journey out to be a little rough. And I get emotional still because it's my story and it's kind of who I am, and I know if I cannot connect with it, then I'm not going to be my true authentic self. So bear with me and give me a little bit of grace today, but I'm going to share just a little bit of my personal journey. So at a very, very young age, I entered a lot of trauma, a lot of different experiences. I lived in an area that was full of a lot of gang violence and different things of that nature. Came from a broken household of poverty, very, very challenging. I attempted to take my life twice at a very young age, started at the age of 13 and continued till I was about 16 years of age, and it was a very dark space for me. And then I started self-medicating with relationships, and I had my first son at the age of 19, so I was a teen parent, and I was just really trying to find the love that I was lacking from a very young age. Experienced a lot of violence and a lot of different things in my life, and I ended up moving from Los Angeles to South Florida trying to get out of a relationship. So I'm a transplant. I've been here since 1992, and I ended up falling into a totally different world, and I ended up self-medicating a little bit more, and that self-medicating took me through a world of drug use, men and exploitation of my life. I was on a path of self-destruction, and I was out there and was decompensating pretty quickly, but I was out there using to die, and that's what my life kind of became. And it was a very, very dark space after the death of my brother and my mother, and I left my family and my 4 children at that time and picked up and walked out of my marriage and went to a life of the streets. And when I say the streets, it's because I lived out on the streets. I was a person that experienced homelessness. I was out there running with some pretty different people than I run with today, and my life became simply unmanageable. I ended up being arrested multiple times, and my life completely changed, and I entered into a very dark world where I was just using drugs to die, basically. Unfortunately, my children were here, there, and everywhere, and I was just out there. It wasn't until I got my last arrest and I was violated and looking at prison time, at which point I found that I was pregnant with my 5th child, and an advocate came in and said, "This woman needs help. If she does not get help, she is going to die, and the baby that she's carrying is going to die with her." And I was able to get court-ordered to treatment, and I went to what was known as the MAP unit back then, which was at Plantation Hospital, and then I went on to other treatment stints. And unfortunately, treatment is not as long as it used to be, but I was in treatment for about 18 months, which meant that my daughter was already getting up there, almost 1-year-old before I got out of treatment, but it was, I will say, a life-changing experience for me. And that life-changing experience came because somebody saw something in me that I never saw in myself. And somebody loved me when I couldn't love myself. And I was able to really start looking at what happened to me instead of what was wrong with me. And a lot of people couldn't really understand why I was out there doing what I was doing, and I couldn't understand it either. But I was grateful that somebody saw something in me that I didn't, and I was able to start a journey of education and pursue a degree because I was trying to figure out why my brain was misfiring and why I would walk away from these little people that I love so much. These little people that I love to get up in the morning and see every day were not going to help me stay well. And I had to dig really, really deep, and I had to educate myself, and I had to figure out what it was that was causing my brain to misfire. And when I started to recognize that it was okay to recover out loud and talk about the fact that when I put drugs in my body, that adverse things happen. And if I don't take care of my mental health, my brain's going to continue to misfire. And it's okay to take medication if you need medication, and it's okay to say, today's not a good day and I got to come back tomorrow. Or to take a step back from life and say, today I've got to do me and I've got to take care of myself. When I started recognizing that, life started changing and things started happening. So for me, resilience means a lot, and fortunately, I was able to graduate a program that was for women and children and get employed by that program. So a lot of people always ask me what worked, and I always say I never left treatment. I always stayed in the middle, and I stayed in recovery, and I worked towards my wellness every single day, and I still do. This December, I'll celebrate 15 years without a mind or mood-altering substance in my body, and I'm able to say that I am reconciled with all of my children, and I can be proud to be called mom. But in addition to that, you know, I'm also a CEO of a program here in Broward County. We are the largest recovery community organization in the state of Florida that provides peer recovery support services, which basically means that everybody that's employed by us are us. We're those people. As everybody always says, you know those people? I'm one of those people, and I am here to tell you that recovery is possible and that life sometimes will make you bend as far as you can, and resiliency is about snapping back, and today I'm snapping back. I'm advocating for other people that don't know that there's multiple pathways to recovery, and I'm here to say that I can be called mom today, so I'm really pretty awesome to be here. So thank you, Stephen.
Well, thank you, Susan. You are pretty awesome. Barbara?
Wonderful story, Susan. Thank you. Stephen, thank you, and the panelists for having me here today. About 3 years ago, May, I'm a proud parent of someone who's in recovery today. About 3 years ago, I got a devastating phone call from my son, who was in his third semester of medical school, and they had moved the medical school up to Tennessee, and it was the day before finals, and I got the call, Mom, my computer is hacked, and I can't get into it, I can't log in, and I can't take the final. And so at that moment in time, I believed him. I said, well, son, just take a deep breath. Let's get out of the apartment, move to a hotel, and sit back and relax, and you'll be able to study tonight and finish and take your exam tomorrow. Well, he moved to the hotel, and at that point, he was hearing noises. At that point, I didn't even know the term auditory hallucination, that were coming through the air conditioning ducts and screaming, and he felt that he was being followed and persecuted. And I said, son, just relax, and we'll get you on the next flight home. And that was the longest wait. That 2.5-hour flight seemed like it was going to take forever getting him back. Well, he had always been an overachiever, a hard worker, and a kid that was on Adderall. And so we got him back to the doctor that was treating him, and the doctor reassured me. And he said, Barbara, it's a combination of the stress, the Adderall, maybe trying to sleep at night from the marijuana, and the combination, and it'll probably wear off in a few weeks. And at that point, I was talking to the doctor, but not in front of my son. And my son wasn't really giving me permission to sit in with him. And the weeks turned into months, and I was getting more and more frustrated because he was a young adult, and as a parent, I didn't have the right to sit in with him with the sessions. And as a former med student, he was manipulating the doctor and telling the doctor what he needed. So I was really, really frustrated, and things were not going good at home. He was plugging up the air conditioning ducts. He jumped off the dock in the back of our house. I don't want to think for what, but it was not going well. And finally, at one point, the doctor said, if he doesn't sign you on to listen and to be part of this, I'm dropping him as a patient. And at that point, as a mom, and I also practice immigration law. So as an attorney, I'm a problem solver, and I was not solving this problem. So I said, well, maybe this is a sign. So I went from doctor to doctor to doctor. And of course, he wouldn't go with me. And I would pretend that I was the one that had the issue to get in to see the doctor. And then I began to learn that, just because you're an MD or just because you're a psychiatrist, there are many subspecialties in psychiatry. Some people deal with children. Some people deal with substance abuse. Some people are specialists in schizophrenia or schizoaffective. And so I was going around, I was camping out in doctors' offices waiting for them to come out in between patients, trying to get to speak to them. In my law practice, I work with a lot of psychiatrists and psychologists because I do immigration law. So many times you have to show extreme hardship, or you have to show psychological issues to the loved one if the immigrant won't be able to come back into the country. So at that point, I was reluctant, but one of the psychologists, a neuropsychologist that I work with, I told her what was going on. I told her about my frustration and that I wasn't getting anywhere. And she suggested someone in her practice who was a specialist in schizophrenia and schizoaffective. And from that point on, we were able to get him in. I used my skills, my organizational skills, to organize my family. And my daughter, who is just graduated now with her doctorate in psychology, she was his confidant. I was not his confidant. I was mom nagging and come on, you got to do this. And at that point, she said to him, listen, you want to go to work. You want to go back to school. It's not happening. So why don't we try this new doctor and just give it a try. And, maybe he'll help to get you where you want to be. Working again, studying again, getting your life back again. And that was the moment, that was the turning point, getting him to the right specialist, and it was a process. It was about 6 months of, I don't even know where the 6 months went. I didn't see any, I worked and took care of the family, and that was it, nothing else. I didn't see anybody, I didn't talk to friends, family. I just almost became a robot dedicated to getting my son back into recovery. And it's 3 years later, and I'm a real proud mom, and he's graduating nursing school this semester, and his goal is to be a psychiatric nurse practitioner. So to all the parents and the caregivers, recovery is possible.
And Barbara, just as a follow-up, what is your own definition of resilience?
I'm a Taurus. I'm stubborn. I don't give up. I'm like a bull in a china shop, and I don't take no. And my cup is always half full. It's never half empty. And I stress the positive, and I look for all the positive. Part of helping me was looking for positive success stories in other people, like the panelists we have here today. So,
thank you. Thank you so much. Cole, if you'd share your story, please.
Yes, thank you so much to the panel, and really for this opportunity to be here. It's absolute pleasure. So I'll just start out by stating, for me, resiliency is a big part of my story. That's obviously why I'm here, but it starts out basically with my identification. I identify as a transgender male, and a lot of you may not be familiar with that term, but in our society now, most have probably heard of it. However, my story begins at a time when a lot of society had never heard of the term, or they may have heard of the term in a different way, more of a oppressive term like transsexual, or something to the like, in which oftentimes people don't even know sort of like what that means. We may have heard the term, but we don't know what it means. So I had a good childhood, so I can't complain there, but I will say that I always felt sort of lost and like I didn't belong, and I was never really sure why. I felt that way for as long as I can remember, even back to elementary school. But for me, real issues started in middle school and high school. And it wasn't necessarily about the folks around me. It was really just about what was happening in me and my failure to identify as belonging to society. But I just couldn't pinpoint why that was. I just felt so different. And it took me down a path of depression and extreme anxiety. So basically, that led to me using things to feel better, and that looked like basically an eating disorder for me. I was very focused on my studies. That's the one thing I was always able to sort of dedicate myself to, and I think it's like it was a distraction from the mental anxiety and depression I had. So I was fortunate in that I was very concerned about my grades. So my mom didn't really know there was anything wrong. Grades are good? Okay, no problems. But when an eating disorder took place, I basically lost a significant amount of weight. I was already sort of a slender frame, so it was noticeable. And my mom put me in an eating disorder facility. It was there that I gained knowledge that changed my whole life. I stayed there for 6 months, but in my first month, with the deep counseling and things to that nature, I was able to uncover more of my root issue, and that was that my identity was not the sex that I was assigned at birth. I was assigned female at birth, but I identified as male. At the time, I was about 17, so it was 2003, and that was a very difficult phrase to say. I remember talking about it with my therapist, and my therapist didn't know what to say. So what I did was I told my mom, someone I was very close with. Unfortunately, she was not open to that at the time. She, for one, didn't know what it meant. And when she did further investigation on it, whatever research was out there at the time, she wasn't supportive. But I continued on, and I knew for me, I knew it was right. There was no question in my mind. It was like that a light switch turned on in my head, and all of a sudden I didn't feel so bad. I wish I could say that's where the story ends, but it doesn't. Things got tougher. I dropped out of high school. I was in the eating disorder facility for a while. Fortunately, my grades, I was, an overachiever, and basically I was able to get my diploma, but I chose not to walk. Following that, I didn't really want to go to college, but my mom, again, even though she didn't really agree with a lot of my decisions, she pushed me to go to college. I was really fortunate to have a scholarship to a Florida school, so I went. And by the time I got there, I had already begun what I call my affirmation process, where I was on hormones. And so I went to college. I stayed close to home. For me, that was Tampa. And I was with students in my classes that I knew in high school that didn't know who I was. They recognized my last name and that sort of thing, but I made up a story that my cousin, passed, which is dramatic, but that's how I chose to deal with it at the time. So to make my story a little shorter, the next 12 years went by, and I never told anyone I was transgender. I told my family. I told maybe one or two very close friends, but I never told anyone else. And so what that meant was I went through college, I graduated, I then went to law school, which is how I got to South Florida. I went to University of Miami for law school. Didn't tell a soul there, and when I got to Miami, away from my family, and I was in law school, a very stressful situation, while I did and I was dedicated to my studies, my mental health broke completely down. I was a mess. I had a big secret, and I was constantly concerned about someone finding something out. I put myself in a million precarious situations that were probably compromising my safety, and it really devastated my mental state. So while in law school, I actually had a suicide attempt. My suicidal ideation was always very high, and I would tell my mom about it. There wasn't a lot she could do from Tampa, but I walked through it. And so the suicide attempt, basically, obviously, fortunately, it didn't work. I'm here today. I was in the hospital for a few weeks, but it was an awakening for me. I knew something was not working. And, my mom, at this point, she was my number one fan. Many years had gone by. She went to therapy herself, and she not only accepted me, she was my number one cheerleader. So I got with my mom, and we talked about what was going to happen. And I was in therapy, and my therapist always encouraged me, you need to tell people, you need to tell people. And I always said, I will never do that. So what I learned was I had to do it. I had to tell people, and I had to let go of my concern about what others would think. So I did that. I was always involved in sports, and at the time I was very involved in CrossFit. I still am. And I reached out to an organization that worked with LGBTQ population within CrossFit, and I told them my story, and I said, I need help. I want to be a part of this committee, and maybe that's how I can come out. So they wrote an article on me. The timing was perfect. I was in this competition that I did well at, and they wrote an article on me, and they said, listen, here's the article. We're posting it on Facebook, and you can too, but we're going to leave that to you if you want to tag yourself. So I was very anxious, but I decided that it was time, knowing that on Facebook were people I went to college with, people I went to law school with, people I had known 10 years, and they knew nothing about my truth. So that night, I tagged myself, I closed my laptop, I went to dinner, and I wasn't near my phone. A couple hours went by, I got home, I opened everything up, and I was flooded with support. It was amazing. And I'm sorry.
No apology necessary.
No one said anything bad. Now, I'm sure that there were people, I know that there were people that were not, open to this perspective, but they just chose to not say anything, which I thought was kind. So I did it, and it felt amazing. And unfortunately, that's also not where it ends. The issue was not about other people accepting me. The issue was about acceptance of myself, and I still hadn't gained that. So fortunately, that happened, though. I was practicing law, and I realized, I was really unhappy in my career. The law really wasn't for me. At the end of the day, I always questioned myself, why did I go to law school? It was never my thing, but I kind of just felt like I had to. I don't know. So I decided to pursue my real passion, and that was to be a therapist. I didn't want to go back to school, but I did. And it was in that process of my master's program that I was struck with a passion that I didn't know I had, and that was toward the transgender community. You might think that how did I not know that, right? Well, I didn't go into counseling thinking I would work with transgender folks. As odd as that may sound, I thought I would work with lawyers who were depressed. I'm not really sure why that was my thought, but it was, and I was so fortunate to have a wonderful mentor at school, and he said, listen, I need you to create a passion project. I was his graduate assistant, so that was my project, and I said, okay, and I'm thinking about the lawyer thing, and one day it hit me, and I'm like, no, I want to work with trans folks, and I started doing research. I read every article I could, and in that process of learning more, and even though I'm trans, just learning, I began to accept myself, and I knew in that moment that my mission would be to help people like me. So, so I graduated, having never wanted to go to school again. I'm now in the doctoral program, and that is my mission. And today, I am a program director at a treatment center for substance use. And as well as that, I'm in a doctoral program, and I have a private practice devoted to helping folks that are gender expansive. But I'm pursuing my doctorate, and this is the important part, because what I want to do is I want to teach clinicians gender skills so that they have the competency to work with folks who are transgender, gender questioning, or in the broader category of gender expansive. Because unfortunately, in our society, that does not exist. It doesn't happen in school, and the stigma around an identity other than, cisgender male or cisgender female is just, it's huge. It's unsurmountable. And the worst part is not about other folks' acceptance. In my case, it was about the fact that I grew up in this society, so I couldn't accept me. So for me, to bring it back to resiliency, I feel that resiliency, a lot like Barbara, is never giving up and leaning on those who are around us to support us. And no is never an answer. And when we hear it, we must open our perspective, and we must seek out anything else, because there is always a solution. Thank you.
Thank you. So Susan, Barbara, and Cole, let me first express gratitude for your willingness to share your personal stories and the power of your personal stories. And I think not only in your sharing today, but I can see also every day how you're also invested in helping other people by what you've experienced yourself. In your stories, it's real obvious that perseverance is a huge part of your own resiliency, and there's incredible courage in what you all shared about your experiences. Can we dialogue a little bit about perseverance, since it seems to be a common theme? And what would you say to perhaps benefit other folks that need to understand the transition from distress and pain to perseverance? What do you think is part of that transition?
I can share first. In my case, and I would say, there's a lot of answers to this question. I think this is a very individualized question. But for me, to make that transition from a place of complete distress and agony to, feeling better and persevering through it, I think it was finding a passion, a reason to live, because distress for me became a place where I felt there were no solutions, and when there's no solutions, it's easy to turn to suicide as an option when it's not. So when I found a passion, and sometimes even before I had the passion, I saw the passion in others, but identifying my passion, it completely shifted that distress, and it just made me feel so much more alive and open and want to persevere.
Thank you.
For me, it was just the. I'm a huge problem solver, and this was the most insurmountable problem of my life that I had ever faced. And I'd wake up in the morning and I'd start Googling. I have a moment at work, and I'd be reading and reading and reading ad nauseum. I'd go to sleep at night and be reading and reading. I'd be reading about symptomology. I'd be reading about medications. I'd be reading about help groups. I would be reading because I felt so weak that the reading, the knowledge was empowering me to be able to take action, because and even before law school, I had gotten a degree in counseling in an adult ed setting, but I felt totally useless, unworthy. I just was not prepared. But the just really delving in wholeheartedly, 100% on all fronts, was what gave me the sustenance to move on, to be able to help my son, I think.
This is interesting, and it's a big conversation, because, listening to you, Cole and Barbara, for me, perseverance has been something that I continue to do every day. But finding that passion, I don't know that I had that. I don't know that I had it right off. I don't know what it was that made me not give up. There was just something, and I always say, I'm super grateful, for the places and the people that I encountered, because it was people like yourselves that, just hearing one little glimmer of that hope, like, well, if they can do it, maybe I just stick around a little longer. And I think for me, a lot of it is just show up, and I kept hearing that from the other people around me, just show up. All you have to do is show up. You don't have to do anything else. And, I just kept showing up, and I think that's what I've been doing for the last 15 years. I think that's why I ended up here. I just showed up, and being able to be here and listening to the powerful messages, it's just like, okay, what else can I do, And it's that self-love, like, how do you find that self-love? Because I still have to dust that off and go like, right. Am I really loving myself? Do I really love everything absolutely about myself? And then I know I still have work to do, So it's one of those things, like, I'm just going to keep showing up, and I'm going to continue to keep putting the right foot in front of the left, and, share my experience, strength, and hope with other people, because that's what's helped me. Because I can't keep what I have unless I give it away. And, there was a lot of little slogans and jargons that I heard coming in the front doors of multiple places, and it's people like yourself, Stephen, I've known you for a really long time, and just people that have continued to love on me. And I think, as one of our shirts say, together we rise. By hearing these stories and just hearing the passion and the pain, I think I've turned my pain into my purpose, which has allowed me to persevere. Because people always ask me all the time, well, what makes you different than anyone else? Honestly, it's just, what am I going to do with that pain besides turn it into a purpose? And my purpose in life is to share with other people and to connect with other human beings that have powerful stories, because I can think of 2 other places that I would like for you guys to come with me to, but I get excited about that. So I'm going to persevere and keep doing this and connecting with people that have powerful testimonies of how life has changed and continues to evolve. So
Yeah, absolutely. There's clearly another theme in all you've been talking about, and that is purpose. You know, the underscore of purpose in life, and empowering yourself so that you can move forward with what you're trying to tackle. You also all talked about some positive influences, and again, this is quite individualized, what positively influences one's resiliency building. But can we talk a little bit more about that? What some of those positive influences have been? They may be similar for folks listening, or maybe insightful for some folks listening.
Sure, I'll go. I think for me it was the people around me. Again, I hate to say that, but for so long I did not reach out to people. It was my mother, but I fought the battle alone, and that was really tough, and it doesn't have to be that way. So I think, something that was helpful was to lean out, to reach out to people. And when I finally started to share with people, I was often met with love, support, and camaraderie in some instances. And ultimately, all of the support I had throughout my life, including the mentor I had in my master's program, I think were amazing tools that I had at my disposal. I just wasn't using them early on.
For me, about 6 months into my son's problem, I knew about NAMI, and I saw that there was a new group forming, Family to Family, and I joined that. And that was a great help. I had wonderful husband and wife educators in the group. I made some lifelong friends in that group that are my friends today, that are all watching today. One especially was almost like a cheerleader to me. There were mornings after Googling from 5 to 7 and reading everything I could under the sun on my son's condition, I'd get an emoji in the morning text from a dear friend from NAMI, and she continues to be that dear friend today. I also, in my readings, one of the big issues that I was encountering was that word anosognosia, a lack of awareness on my son's part that he had issues. And so I read this book, I'm Not Sick, I Don't Need Help, and it resonated with me, with my former counseling background. And I ran up to a gentleman in New York who is a psychologist, and I took some training with him. He trains clinicians, and he trains family members. And I was so excited with his message about partnering and stop putting your loved one down and nagging and changing the approach. And it really worked. That really worked for me to the point that I joined his board of directors in New York, and on the message of partnering and how to approach your loved one and how to find that common ground that's going to get you the help that you think that your family member needs. And those things were really important for me, I think.
Thank you.
I've had a lot of positive influence. Like how long am I going to take? But I think in all fairness, the first, they're not little people anymore, but they'll always be my little people as my children. My children, they showed up in jails, they showed up in institutions, and they never gave up, on me. And that was powerful for me because they've always loved me, even in my darkest moments. And they still show up, which is awesome, My daughter actually Googled my name and goes, "Mom, you were a drug addict? What do you mean?" But they still show up and they support me. So, those are the positive people in my life. But also my therapist. I always say I have a life-saving therapist who is now one of my board members, who's amazing and who taught me how to love myself first. And, of course, Officer Burks, my probation officer. If it wasn't for her violating me and taking me into custody that day, I probably would have died. I'm super grateful for her, and I never thought that I would thank law enforcement, but I'm super grateful for our law enforcement officers today, and I don't have to worry about the red and blue lights behind my car anymore. But there's been some really powerful people, including both of you. Stephen, you've had tremendous positive input in my life professionally. So it's not just for my personal journey. I've had a lot of people support me professionally as a former convicted felon, getting my background cleared to work in this field, to have a clinical degree and to be able to do the work that I do. I have a lot of positive people. So if I didn't mention people by name, it's not that I'm not thinking about you. All these people are always in my prayers because I'm grateful.
Thank you. I feel like my resilience is becoming stronger by just moderating this panel today. So clearly this is about people, and the audience wants to know a little bit more than just people. They're asking how you practice self-care and self-love in your life.
Yeah, that's a tough one, especially working in this industry. I was just talking about how, you get stretched a little bit, but, I've learned that I've had to kind of take charge of my life and find a balance, and as the wellness guru, wellness recovery action planning for me has been instrumental to help me find balance, and really focus on things that help me stay well, so I don't have to visit those institutions again. So I do have a daily maintenance plan, and I also have a might-do list that I work on. And I do morning readings, and I do reflections at night to see, where I might have missed showing myself a little bit of love. So definitely wake up in the morning and hit my knees, and before I go to bed at night, I'm thankful for all of the people that I've had an opportunity to be impacted by.
Well, I'm speaking as a mom, as a caregiver, and for me, the balance is being able to give my son the independence that he so deserves. And since he went into successful therapy, I've been with him at every session, and there are times when he'll ask me to excuse myself, and I will, but I know there's a point where he's going to go into his sessions himself, and he's ready, but I kind of selfishly use it as our time together, just the drive over there, and getting him to empower himself. But he's at such a point now that I know I need to step back as a parent, as a mom, let him spread his wings. And, I said to him, I was lucky to have children late in life. And he says, but, Mom, you won't always be here, and I have to do myself. And that's another thing as a parent. Yeah, we won't always be there. And I told him, I'm going to look down from heaven, I hope, and I'll be haunting you as a mom. And we laughed. And I have to say at this point that things are so great, and to all the parents and caregivers out there, that, he's become my caregiver now. He counsels me. So the tables have really turned. So for that, I'm grateful.
Thank you. Oh, anything about self-love?
Yeah, I love this question. When I think of it, I think about the word my wife and I use is how do we fill our cups, right? Because both of us are clinicians, and when we work in the field, we certainly we definitely hold the space for a lot of people, and that can be exhausting. I love it, but it is also exhausting. And when my cup is starting to run dry, I need to fill it. And for me, that looks like family time. Even if it's just to take 15 minutes at the end of our day, my wife and I always check in. But as far as me individually, I have hobbies that I like to enjoy. Sports has always been something that I do for myself because I feel a connection in any type of sport. So that's something that I don't care how I fit it in, it's got to be there. It's helpful for me. Right now, it looks like a 6 a.m. workout. Otherwise, it doesn't happen with my schedule. But other things I like to do, are just like hobby related. I like to woodworking. For me, that's like almost a meditative state where I can really just kind of have my own time and just sort of be with myself. And those things are really important for me. I notice within myself, or my wife will remind me if I have not been doing things to care for myself, because my level of agitation will go up and I might start to feel depression. And that doesn't work for me in my life today. I have to make sure to fill my cup and do whatever it takes to make sure that I hold myself accountable to giving myself that self-love.
Thank you. Barbara, did you want to add to that, or?
No.
Okay. So one of the things that I want to share just from my own experience is one of the things that this pandemic has taught me is some of my self-care has been around interaction and involvement with other people. And the pandemic has stopped that. So I've had to increase the self-care activities that I'm able to do independently. And in many ways, I think that it struck a very positive balance in my life in terms of being able to initiate and conduct the things yourself without it being reliant on an interaction with other people. I want to just remind the audience that if you have any questions, please feel free to send them to us. I want to shift a little bit of our conversation. I want to talk a little bit about stigma, because stigma can be a dangerous barrier to people's ability to recover, to build resiliency. I'd like to hear some of your insights on how we might be able to combat stigma, what your thoughts are related to that, including, there's obviously stigma that a person who is struggling themselves may feel. There's stigma caregivers feel, parents may feel as well in the process.
Yeah, I definitely. This is a sore subject for me because we experience it a lot. We see it a lot in our communities and in the interactions. Even me working with other parents, my daughter's friends and things like that. And a lot of times it's not intentional, it's just lack of knowledge. So I think one of the biggest things is, how do we engage and educate people a little bit more? That we're not those scary people, that we are people that live with chronic health conditions, just like, going to the doctor for, diabetes or anything else, and, to be able to have those bigger conversations. So I think for me, I've really taken on, a mission of recovering out loud and not being fearful. It was funny, I was at dinner with a group of soccer parents and they're like, "You're not going to have a drink?" And I said, "No, I haven't drank in almost 15 years. And they're like, "Wow, that's awesome. Tell me about that." And, and then it opens up that door to have that conversation and to be able to say, I have big moods, and sometimes my moods are a little extra high and sometimes they're a little extra low. And just being able to normalize the conversation. It's not scary, it's not bad, it's just sometimes chronic health conditions manifest differently. And I think that's what I've really started doing. So our next shirt's going to be Recover Out Loud with the Rolling Stones tongue, because we got to talk about it. We got to normalize these different conversations that we're having. I too have a son that was trapped in a hotel room till I flew to California to get him. So I understand what that is. And if we don't start talking about the challenges and make mental health, substance use, behavioral health challenges something that we can talk about. Things with gender, let's have conversations, and I think that to me is going to eliminate the stigma. And I think for us as individuals who identify as being in recovery from whatever it may be, I think we self-stigmatize too by using certain language and doing certain things, so I think we need to talk more. Yeah, definitely.
Other thoughts about combating stigma?
Yeah, thank you so much. There are so many words you took like right out of my mouth. I think stigma is obviously something that is prevalent in our society at this time, in many respects, not just to the reasons we're sitting here today, but education and transparency are so key. And when we don't do those things, when we keep it a secret or don't talk about it, all we're doing is that we are helping stigma to thrive. So the opposite would be talking about it. And, I think it's important to say that those are really difficult conversations. And there are a lot of people out there who are not open to having them. But we got to give people the opportunity to have them. And we can do that by bringing it up. I do not hide that I am transgender anymore, even though I did for 12 years. It is something I freely talk about because I want to educate. And when I approach someone who I immediately feel or know has a stigma with regard to my identity or something else, I try to, instead of being upset, frustrated, and not have any empathy toward that person, I try to look at it from a perspective of curiosity, of like, I wonder why they're closed off. I wonder what's going on. And that really helps me to not, again, feed the stigma. And then I'm like, oh, I don't like that person because they don't get it. Well, maybe they haven't been faced with this in their life. Maybe they grew up in a home that sort of thing never got discussed. Maybe it's not their fault. And maybe I can help them. So let's talk about it. Let's talk about what's going on. So for me, to combat stigma, I think it's really important to talk about it, even when it's uncomfortable, and to be curious. What's going on here, and how can I help, if at all? Maybe the person really just won't want to go there yet. But I think that it's important that we don't automatically push them aside, and even at that moment, push them aside, because maybe later, maybe we can plant the seed, and maybe later they'll be open to it. Or maybe one of us can be the person to help open their minds to something else and to understand, because I think that's the base. When we have an understanding of someone else's perspective, the stigma starts to leave. And I think the last thing I want to say is that idea of language, which you brought up, is so important, especially when we talk about gender and even substance use, right? Because there are so many very oppressive terms that folks use that are just awful and bring a person down. And language is imperative. The funny thing about language is it changes daily, especially with regard to the gender community. I know we've all heard this acronym that's, who knows how long. And I think it's important that we stay educated with language that's going to empower folks and not press them down. We need to help lift people up rather than push down.
Well, I have an interesting perspective that's kind of global, because I do immigration law. So if you think we are battling with stigma in the United States, in Latin America, it is huge. And when people come in to see me, and if I hear any kind of disparaging remark regarding mental health, I'll always take the time to gently educate, to share, maybe not too personal, but share that I do have experience in the area, and to sensitize individuals. I work with a large international student population, and during the last year and a half during the pandemic, I've seen so many students suffering mental health issues. A lot of depression, a lot of working with foreign student advisors, trying to keep these kids in status, not having them drop out of school. So that's become an area that I'm trying to cut through the stigma of mental health issues and work with the universities in trying to realize that kids, they're not in their home country, they're here studying, they may do depression, they may have other issues, and we need to work, and working with them to help them for the purpose that they set out for, to get a good international education. Also, there's people have come to me and very meekly say, my family member, my son, my older daughter who lives in Peru, who lives in Bogota, has schizophrenia. And they're almost ashamed to tell me that. And then I say, just, you've got to relax, understand. But during the pandemic, many of these people's caregivers, be it a grandparent or another parent, if the parents were separated, passed away during the pandemic. So we have these people who are wandering around without sufficient care in different countries. So this has been a huge issue for me. So I'm taking the time to educate people. Don't be afraid, come out. There are plenty of resources in our community, and then internationally begin to hook them up and know that there's help, and we can eventually bring their loved ones in. So that's another area that has been huge for me, personally.
Thank you. Thank you all. So I know that a good portion of our audience are individuals that are helpers in one way or another, whether professionally or personally. So what's your guidance for people in the helping role? And don't be afraid to also share if there's something that didn't work, even if it was obviously well-intentioned.
That's a big one. It's a big one, and I say it's a big one because I work with those challenges now, because we do a lot of linkage to various services, and if I can say, first and foremost, thank you for the work that you do. It definitely doesn't go unnoticed, and I will also say, because a lot of times we don't realize that that phone that's ringing again could potentially be somebody who really needs some dire help. And the reason why I say that is because we get a lot of phone calls in our network for individuals who have tried to walk through various doors in our community, who continue to knock and who don't get through those doors. And I say that because we work with the most underserved individuals that there are, which means that they do not have health insurance, they do not have family members, they do not have any form of resources at all. And fortunately, I have an amazing team that works countless hours, 24/7, answering phone calls and linking people to care. And maybe people won't call you and thank you for the work that you've done. I'm thanking you for the work that you've done. Please take care of yourself. You're definitely needed, and please answer the phone. There's a lot of people that need things. It's not personal. Sometimes when I've had big emotions and had temper tantrums, it really wasn't towards you as an individual or a professional. It was really because I was in so much pain that I needed to take it out on somebody, and it was probably misdirected, and that happens a lot by our community members and our loved ones that aren't getting the help that they need. We're in the middle of a global pandemic that has kind of derailed our behavioral health system, and there are a lot of people out there that need help. There are so many people in so many capacities, Stephen, and this is something that it's hard for me because, as I said before, I'm a CEO, so it's easy for me to pick up a call and call another CEO, but those community members don't have that, and I can't help everybody. So please make sure that your front doors are open, that your staff are trained, that they understand that this isn't personal, but our community is in a lot of pain, and there are a lot more people coming up with mental health challenges, emotional distresses. Link them to somebody that can support them because we need them in our community. And my biggest ask is that if somebody is not okay, it's okay for them not to be okay. Just make sure that they get to the right place to get the help, because we've lost a lot of people this year, and all I can hope is that we can be a resource to other individuals. So if you're taking the time to be here, utilize any of us as a resource. I know that we're always available, but it's a huge ask, and I know that, but I get super passionate about this because there's so many people in pain today. And be mindful of the language. I hear it all day long, and it makes my skin crawl sometimes, because that oppressive language, like you said, Cole, it's hard, you know, and if you say that wrong language to the wrong person, they're not going to ask for help. So they need to trust us. That's it.
I would say that everybody who's listening today, you're listening because you're listening with a purpose. And the entire audience, everybody has the ability to contribute in some way, individually. And selfishly, I couldn't wait to attend the seminar today so I could reach out, hear everybody's stories, see what's new, learn new things in psychiatry, plus give my own testimony. I mean, the first time I was ever in a walkathon, I never did walkathons for any thon, was a NAMI walkathon. And I walked, and boy, was I proud to walk. You know, that was like 2 years ago, and I've lived my life and never been in one walkathon, but that day I walked. But there's so many areas you can reach out. You can be on hotlines. You can get into legislation if you want to change the laws of our state. You can volunteer in a drop-in center. There are 1,000,001 ways to contribute. And if you have a little bit of inkling or inquisitiveness, or you're on that journey for yourself or for a loved one, you know, all of us on the panel here can be used as resources, everybody today, to help you find your own inner gift to give back and to help, I think.
Thank you.
Thank you. For me, again, thank you to all the professionals out there who are helping folks going through a time of difficulty. So I think that, you know, things that haven't helped, I kind of want to touch on that, because I think it's really important. You know, we talked about education and transparency and all those things, and the thing that I encounter the most with clients who see me for gender expansive issues are difficulties from past clinicians who were not at all trying to harm. They had the best intentions, but unfortunately, without the education and the knowledge to help folks who identify as gender expansive, it's not enough. And I think it's really important for us to have the education to know when this is not my area. It's time for me to look for resources and refer out. Because, and something I say often is, you know, good intentions does not equal competency. There are some really well-intentioned folks out there, and I've heard from colleagues of like, well, hey, I'm super interested in working with these folks, and I'll just learn from this client. And to me, that's like not an answer. We cannot, yes, we do learn from our clients, but to learn how to work with our client doesn't work. You know, and I'm saying that as someone who has done a lot of research in this area and know that there is harm that is done, even when intentions are high, even when they're good. And, you know, all helping professionals, I like to think, are never with poor intentions. So I think a big part of it is knowing when this isn't my area. You know, there's plenty of areas that aren't my area, and if I don't feel I can help a client, I reach out and I try to find every resource possible. You know, and I think that if someone is interested in getting to know a certain area of, you know, their profession, it's great. We need to get the education from somewhere else. We can't rely on our clients to teach it to us. And so whatever that looks like, trainings, you know, reading articles, getting a supervisor, these types of things are all wonderful skills to help get into those various areas without leaning on a client or multiple clients. As far as things that have helped from professionals, I think, you know, all the therapists I saw, oddly enough, never had seen another transgender client prior to me, which that's not odd considering it was 2003, and throughout my time in therapy. At the same time, they were willing to work with me, and thank God for that, because otherwise I would have had no one. But the thing I always heard, and I mentioned it earlier, was you got to talk about your stuff. You can't just keep it all in, and you can't just be me, meaning the therapist. It's got to be to my friends. I have to share my truth. And I feel like that was some of the best, you know, and I was invited to do it. I was never told. It was an invitation that they would give me. And I think that part about a therapist giving the invitation to their client and not telling them what to do, because we don't give advice, but to have that invitation, it allowed me to do with it what I wanted and when I wanted. And I feel like that was some of the best help I ever got.
Sure, go ahead.
I just want to make one comment that it's really, really, as a caregiver, important to listen to your loved one. And I thought you had to have a psychiatrist and a psychologist, and you had to have both. And the psychiatrist was working, but, and the psychologist had wonderful credentials, but it wasn't a good fit for my child, my son. And it's important as a caregiver to listen, to see what works and doesn't work. Just because someone has a beautiful CV doesn't mean that they're the right fit for your child.
Thank you, Barbara. So I just want to ask you to respond to one more question, and then I'll ask for your concluding remarks for today's panel. But even resilient people have setbacks. So as strong as we are, there can be setbacks along the way. How do you handle setbacks?
I don't. No, I'm kidding. I'm kidding. I always use the term, I'm going to dust my knees off and I'm going to stand up and I'm going to keep going. And I think that kind of rings true of never giving up. And I ask for support. I've learned to ask for help. As hard as that was for me, being able to say, I just need a little bit more support. And, sometimes I cry about it. Sometimes I have to walk circles around myself, because most importantly, and I think it's important for people to know, is everything in my life isn't perfect because I'm in recovery. It just means, and recovery is super messy, so it ebbs and it flows, but I just, again, I keep showing up. I do the best that I can for today, and I ask for support when I need it. I cry when I need to, and I have found time to laugh, which was really hard for me, because laughing for me when I was in my past meant that I was doing things that I wasn't supposed to be doing, but laughing to me today means that I'm celebrating the good times, the rough times, and the challenging times, so I've learned to laugh. So that's where I'm at.
Susan.
I recently had a little bit of a setback regarding my son's medications. And the whole goal of med is fine-tuning it, tweaking it, and getting the best results without having the medicine control you. And he indicated that he wanted to move from the Invega Sustenna to the Trinza. And the Trinza is an antipsychotic that's given every 3 months and 4 times a year instead of month to month. And, I could see a little bit of hesitancy on the part of the physician, but he allowed my son the space to try it. And, we tried it. We tried it for 2 consecutive 3-month periods. And for him, it wasn't, I felt disappointed because it wasn't as effective. That 3rd month, it was wearing off. And, he was at a critical time that I was concerned for his academics, for his future, for his graduation. And I said, it just wasn't meant to be. There are worse things than getting an injection once a month. So we talked about it, we dealt with it, and I said, and we also discussed it in a way that all the new things they're coming out with regarding pharmaceuticals, and how, eventually this drug is going to become an over-the-counter drug eventually in the future. Kind of thing. So, and that there are more and more things to look forward to. So for me, it was a disappointment because I was hoping that he would feel more of a sense of independence, less reliant on the drugs. But we kind of, with a lot of love and talk, we kind of worked it through, and it's okay. And we're back to the monthly.
Thank you. Cole?
Thank you. Yeah. I wish I could take credit for this, but I saw an amazing speech one time, and it was, the sentiment I took away from it was, bring on the nose. And nose being N-O, right? And so for me, anytime I get a setback, I think of that. And the idea behind that was, it was a graduate of some school talking about how difficult it was to find a job, and she was getting all these no's and all this thing. And eventually she came to the idea of like, you know what, tell me no, because then I'm going to go somewhere else and I'm going to find the yes. And it was like she used it to fuel herself to continue on. And she eventually was like, okay, bring on give me another no. And another no? Okay, where's the yes? Because I'm going to find it. And so I think of that every setback I get, and I think, you know, just like Barbara said, it wasn't meant to be. So now I get to find what is meant to be. And this setback, this was meant to be. Even though I might hate it in this moment, I may not understand it, I might not be able to make any sense of it, I will find what is meant to be, because this was supposed to happen to fuel me to that next step, to bring me to the yes. I need the no's so I can get to that yes. So I think of that, even when things are devastating, maybe not right at first, but I try to make that the next thought of, give me that no, and I'm gonna go find that yes. No matter how difficult or hard, you know, arduous that struggle may be, I will find it. And it may take me some time, but we will find it, and we will work through it.
That's good.
Yeah. I've had many moments in my life where I came to the conclusion, I'm going to prove this wrong.
Yeah.
And that's how I moved on. Barbara, what's your takeaway message for today?
Just for all the parents and caregivers out there, you know, it's a process. It takes time. You know, don't look for the immediate fix. It does take time, and time is a real funny thing, but there is hope. There is recovery. And one of my mentors said to me, you know, this is just a temporary setback. And, you know, your son can be anything he chooses to be. And he's on that path right now to being exactly what he wants to be. So, thanks.
Thank you. Cole, your takeaway?
Yeah, for me, I kind of want to state what I feel is a bit of the elephant in the room, and that is us three up here, we all have some success as far as professionally in education. And I want to make it clear that that is not necessary to have perseverance and resilience. Those things we are fortunate, I am grateful, and it's odd that we all have education and we had that opportunity, but there are so many out there that do not have that opportunity for multiple reasons. And I think it's really important that we don't look to us as any type of standard, because there are so many folks out there who are incredibly resilient, and they may not have had an opportunity for education, and they may not be, you know, a CEO, but they are resilient, and they have found a way to keep putting one foot in front of the other and moving through life and helping people in whatever capacity that might be. So I think it's really important that we take a look at that. It just so happens that that's how it panned out. I didn't even realize, but I wanted to make that really clear, because there are so many folks out there that there's no link. There is no link, and I think that goes to how we measure success. And for me, the way that I measure success is, do I accept myself, and am I content in my life? I think that is, and if I am, then that is all the success I need.
Thank you. Thank you for making that point. Susan?
Yeah, awesome. Thank you. Thank you, Cole. Thank you, Barbara. I appreciate you, too. I will tell you, for me, and not only just for me, but in National Recovery Month, our slogan for this month is recovery is for everyone. Every individual, every family, and every community. So with that being said, I just want to say to Cole's point, you know, recovery is whatever you want it to be and whatever you see it being for you. So I just want to say, never give up, and just put the right foot in front of the left and keep going.
Thank you. So today in our conversation about resilience, I heard about acceptance. I've heard about compassion and passion. I've heard about a hopeful outlook. I've heard about finding meaning, fortitude, and I've also heard about the real importance of having joy in your life. One of the questions I asked you was how would you combat stigma? And I am truly confident that by this conversation, we've done that today. So I'm grateful for all of you for sharing all that you have. Also know that you have positively influenced me. You've made me stronger today, and I appreciate that. So thank you so much. We wish you well on the continued summit. The next panel deals with connection, and we, as this panel on resilience, want to underscore that connectedness is yet a really important aspect of resilience. Thank you.
For the community.
Because now I feel like there's a light at the end of the tunnel.
To protect my patients.
Because I wanted to protect myself.
So I could go visit my mom.